Hey folks, Nelson here. Um, Going on day 6 at Milton Hospital. Yesterday was transported to Trillium Hospital and brought back last night. Did an angiocardiogram yesterday. Everything came back normal. I just wanted to share some of my experiences and things that I've seen and overheard with nurses and EMS personnel regarding COVID. Because it's getting really concerning and a bit dismayed and frustrated with the recklessness of people and some of the comments I've been seeing online and social media. It's just crazy. I can tell you firsthand, the hospitals are overwhelmed. Nurses, doctors working overtime, looking for breaks, just absolutely getting slammed. At the Trillium yesterday, one of the busier hospitals in Mississauga, they actually have tents set up outside and domed, like your kids are playing indoor fields for COVID patients and COVID testing. Super concerning. The nurses at the stations where I was at a short stay and day surgery were actually talking and concerned about their units being shut down for COVID patients. And that's really, really scary because now people that are supposed to go in for minor surgeries or to get things removed or fixed, or like myself for an angio, are going to get postponed or delayed and not be able to go in. And that's really dangerous, and that's affecting everybody's health. EMS personnel that transported me to and from the hospital were talking to me about the calls they've been going to in different areas and where people are positive for COVID and calling them to show up to their house because they're not feeling well, and they respond and they find that the house is full of people. No one's been quarantining. They've all been going to work, and it's scary, completely reckless. Some of the hospitals, they were telling me in Brampton, for example, were so full last week and to capacity that they were transferring patients down to Toronto, which is scary because Toronto has a bunch of cases. Folks, this is real. Anyone who doesn't believe this is real, you need to pay visits to some of the hospitals and see what's going on. We need to get off our political high horse, whether you're left or right. Get off of your conspiracy theory box. Shit is happening. People are dying. People are getting sick. It's very, very scary. Like in the U.S. right now, they're projected to have 2,000, on average, 2,000 deaths per day by December. And by January, that number is going to jump to 4,000 deaths per day. That's unacceptable. And that's legit. No one's making up those numbers. People are dying. In Ontario, we just had them roll out the new model that's laid out. We're expected to see about 3,000 positive cases a day now by December, and by early January, 4,000 cases a day. Again, unacceptable. People, we gotta lock things down. We gotta stay safe. Wear your mask and wear your mask properly. Cover your nose, your mouth, your chin. Wear comfortably. A bunch of yahoos walking around with masks on their chin that doesn't do shit. There's so many things going on. There's so much evidence right now out there of what's been happening. Doctors and specialists telling us what's going on. And I can't believe in this information age where we have all the tools at our disposal where instead of looking for truths, we're looking for falsehoods and conspiracies and lies and all this nonsense, which is garbage. When all you gotta do is look outside your door, look at various news reports from all over the world. It's happening everywhere. Not a conspiracy theory, not a hoax, legit. People are dying. In no time, one of the examples, we're talking to the paramedic yesterday, was people don't understand viruses and diseases. I'm not a doctor or a PhD or anything in this field, but all you have to do is look back at history where viruses and diseases have changed and developed. The way we treat certain things have changed and developed. Nothing is the same. So some people pointing out to some of the scientists and epidemiologists how they've changed their path or they've changed their tune. It's simply because the virus changes and medicine needs to change and procedures need to change. It's not because it's not real. It's not because it was fake. It's because it's changing, continuing to change. In no time have we ever been in a place in history where we don't trust doctors and scientists. It's absolutely ridiculous. If you were living right now in California during wildfires, and a fire marshal and police knocked on your door and told you had to evacuate, and you stepped outside your house and you saw the fires, you would get the fuck out of your house. You're not going to sit there and argue with them and think they just want you to leave your house. And that's what we're doing right now. Too many people are sitting around thinking this is bullshit. The other myth I'd like to clear up for some people is everybody thinks this is you get COVID and you're okay, or you get COVID and you die. It's not a one an all or nothing proposition. People that wind up getting COVID wind up being sick. Some people get over it, yes, better than others, but some people wind up having, they're finding now, some people wind up having long-term ailments, cardiovascular issues, amputations, blood flow problems, a variety of issues. It's not a one and done situation. And going back to the hospital point, what this does is puts a huge stress on our hospitals because more people wind up in the hospitals for all these various ailments. Absolutely crazy. Folks, I just want everybody to just pay attention to what's going on. This shit's real. Take care of yourselves, take care of each other, wear your mask, social distance, stay in your small groups with your families, bite the bullet for a couple of months. Let's shut this down and be safe. Love you all. Peace.